at the operational strategy that we have chosen, there are some weaknesses that need to be considered. The three major weaknesses that have been identified by researchers in relation to wearable technology in the healthcare setting is the inaccurate data collection and inability to reproduce that data, growing diversity of medical wearable devices, and the questionable impact on patient clinical outcomes due to the devices. As far as data accuracy and reproducibility is concerned, wearable devices generate and measure data on a patient's behavior and well-being, which can include glucose levels, heart rates, and other vitals. But many of these gadgets are not FDA approved, and therefore the sensors and the readings are not regulated and can become inaccurate. Furthermore, real-time data processing and visualization are essential when implementing medical decisions based on wearable devices on a large-scale basis. In this process, since they're not regulated, even a 2 to 3 second lag in recording time could seriously affect the performance of the healthcare system and or the medical device, as well as decisions made by physicians based on those vitals and the conclusions based on treatment that they would determine from it. The next one that we need to discuss is the growing diversity of medical wearable devices. Currently, there's a huge range of medical devices out there that range anywhere from the Apple Watch, which records vital signs, to the Fitbit, but also to dog tags imprinted with the ability to record data, medications and pills with sensors in them that allow physicians to track medication adherence and whether or not patients are taking the prescribed medication correctly. With all these different forms of medical devices, there is a need for the connectivity of the technology and the software to be able to import that information from the medical device to a platform that the physicians are able to utilize. With that comes increased software and associated costs as far as the technology that you would need to upload that information into the system. And those costs can be exorbitant for a large medical program such as United Group. The final one is whether or not there's a huge impact made on clinical outcomes due to wearable technology. There was a study published by Cedars-Sinai Hospital early 2018 in which they used medical wearable technology for patient monitoring, and they determined that it really had a limited impact on clinical outcome. And this is due mainly to the fact that there was an inconsistency among the sensors and the devices, like we spoke about before, but also the ability to take quick action on changes when the devices aren't continuously monitored. I will say across the board, researchers believe the findings of wearable monitors and devices could potentially be very helpful in the healthcare setting and to healthcare professionals to help develop personalized treatments and plan of cares, and anticipate the need for intervention should patients' vitals start to if a patient's vitals start to have issues that they're showing. And they can do this even before certain symptoms become prominent to the patient if a certain disease state is occurring. The FDA does also share the enthusiasm with these medical devices, and they introduced the Digital Health Recertification Program in late 2007 to try and help regulate the medical devices and the data that they were collecting. But currently, due to these three major issues, there is some strong weaknesses, or there is some weaknesses that need to be addressed when discussing an operational strategy to include United Healthcare using these devices as part of their incentive program or paying for employees to use them when they're not as accurate as they should be.